This is Kate. She is a wife, a mother, and a registered nurse. This year, Kate turns 65 and will encounter the sometimes complicated journey to Medicare. These are important things to consider, important to Kate and important to me, because Kate is my mom. So my mom is a nurse, and she still works basically full time. And I think she's in a similar situation to a lot of people where, she's really working to have health insurance. That's one of the main reasons that my mom continues working is to maintain her health insurance, because she doesn't want to go without, obviously. And it's cheaper to have the group coverage than to go out on the marketplace. Mm-hmm. And so my mom is looking at Medicare as sort of a pathway to freedom. Once she gets Medicare, and once she gets on the right, Medicare health plan, she'll be able to do some of the things she's always wanted to do, travel more. Yeah, get out of town, travel more, and have more time to relax and play and do the things that she wants to do. So Medicare is really like the finish line for her as far as the working life and transitioning into more of a retirement life. So I'm really excited.
Or the beginning line of freedom.
It's the beginning of a new life, right?
Tied to a company, because if I did go through the Affordable Health Care Act or whatever, I make too much to get any affordable health insurance. So actually, I have tried that. And my $7,000 deductible is going to cost me $900, or at the time, 3 years ago, when I looked into it, it would cost me $900 a month for a policy that was a $7,000 deductible, and really didn't do much for me.
So Kate, is it safe to say that you've been watching and waiting to approach that magic age of 65, so Medicare can free you up?
Let's just say I made it to 65. So how that happened is a miracle to me. But anyway, because of that, I get the opportunity to look forward to that.
Nice. You're approaching the starting line. That's what you're doing.
Yes. Starting line for my older years to have some fun before I get too old to have fun.
Excellent. And Alissa and Kate, you've both brought up a good point, and it's becoming very common, is that of people holding on to full-time employment and sometimes part-time employment for health benefits alone. Mm-hmm. The cost is astronomical. What you cited, the costs you cited, they're so high, and that was 3 years ago. So we all know that those costs have done nothing but increase in that period of time.
You need health insurance.
No, absolutely, and that's sadly enough, I come across many people who are in that phase where they may have already retired, or they've cut their hours back, so benefits are no longer provided. Mm-hmm. And they're waiting for Medicare to be able to kick in. They're waiting for that eligibility, because sometimes it's just so expensive that people choose to not purchase health insurance and take that risk, for a couple years. And that's a frustrating place to be. I don't think people should have to find themselves in that situation where you're trying to figure out, how can I even afford to cover myself? But then you have these conversations when we start talking about Medicare plans, and it almost sounds unbelievable compared to what you've been looking at, and go, wait a minute, this is real? These benefits are available and it only costs that much, really? And it's, that's the fun part of it. It would be nice if it happened sooner, but that's the fun part of it. When, I love to tell someone that's turning 65, and I just had this experience a couple days ago, and I said, hey, here's the news, and all of it is good. There's options, there's plenty of things that you can choose from, but just know right up front, it's all good news.
My mom is also living with a chronic condition that she takes medication for. And that medication is very expensive if she were paying retail or if she were paying out of pocket. Those preventative services are what helped her find out that she had this chronic condition. Without the proper screenings and without her physicals and her checkups, this might have gone unchecked for, who knows how long.
Right.
And so, I've seen it with people that I know, and I've heard it from agents that, just like you said, Tim, some people, because they can't afford the health insurance, if they're not employed and they don't have group coverage, they go without health insurance. So they're not getting their yearly physicals. They're not getting their blood work. They're not taking their prescriptions. And it's just like the quality of life without proper health care. It can be life-changing when they get the proper insurance coverage. And not only that they actually use it to the fullest and get the most out of their plan. So hopefully that's, as we get closer to my mom's birthday in August, that's what we're going to be discussing. Just, her needs, her health care, her budget, and putting all those things together to put her in the right plan that fits her.
Turning 65 with Kate is brought to you by Advocate Health Advisors. Click the link below to follow Kate's exclusive story. Advocate Health Advisors. We are guides, we are local, and we are on your side.